Welcome to the TOEFL listening section. In this part, you will hear one or more conversations in an academic or campus context, such as a discussion between a student and a professor, or between two students. You may take notes while listening. Listen to part of a conversation. You will hear it only once, so listen carefully. After the conversation, you will answer questions about what you heard. Some questions will ask you about main ideas and details. Others will ask about implied meaning, speaker attitude, or how ideas relate to one another. Use both what is stated and what is implied to answer.
Good afternoon, Professor Ellis. Thank you for meeting with me during office hours. I am writing my term paper on circadian rhythm disruption effects, and I need some guidance on endocrine mechanisms and real-world examples.
Good afternoon, Maria. That is an important topic, especially with so many people doing shift work. Start by telling me what you already know about how circadian disruption affects hormones.
I know that the suprachiasmatic nucleus in the hypothalamus is the master clock, and that light is the main cue. But I am unclear how shift work actually changes hormone patterns, like cortisol or insulin.
Right. The SCN sets a 24-hour rhythm and synchronizes peripheral clocks in tissues like the liver and adipose tissue. Shift work often desynchronizes those peripheral clocks from the central clock, and from behavior such as eating and sleeping.
Can you explain the hormonal consequences of that desynchrony in practical terms?
Sure, one clear effect is on melatonin. Melatonin secretion from the pineal gland normally rises at night. Light at night suppresses melatonin. So night shift workers often have chronically low nocturnal melatonin levels that alters sleep, and also removes melatonin influence on glucose metabolism and antioxidant protection.
So melatonin suppression is one key change. What about cortisol?
Cortisol follows a robust circadian rhythm with a peak in the early morning, and a nadir at night shift work flattens that rhythm. In many studies, night shift workers show a blunted morning peak and higher evening cortisol. This dysregulation is linked with impaired glucose tolerance and increased central adiposity.
You mentioned glucose metabolism. Does that mean shift workers have higher diabetes risk?
Yes. Epidemiological studies show higher rates of type 2 diabetes and metabolic syndrome among long-term night shift workers. For example, a large cohort study of nurses found an increased risk of metabolic syndrome after several years of rotating night shifts.
Is that due to sleep loss or the circadian misalignment itself?
Both contribute. Sleep deprivation reduces insulin sensitivity and raises ghrelin, which increases appetite. Circadian misalignment independently alters gene expression in the liver and pancreas, affecting insulin secretion and beta cell function. So you have overlapping mechanisms.
You said ghrelin increases appetite. Does leptin change too?
Leptin is often reduced with shift work and sleep loss. That combination of higher ghrelin and lower leptin promotes weight gain. Shift workers also tend to eat at night when peripheral clocks are not prepared for nutrient processing. So postprandial glucose excursions are larger.
Are there inflammatory effects as well?
Yes, chronic circadian disruption raises inflammatory markers such as C-reactive protein and interleukin-6. Inflammation then contributes to cardiovascular risk and atherosclerosis, which partly explains the higher incidence of heart disease observed in some shift worker cohorts.
That ties together metabolic and cardiovascular risk. Interesting. What about reproductive hormones?
In women, night shift work has been associated with menstrual irregularities and reduced fertility in some studies. Altered timing of gonadotropin release and disrupted melatonin can affect the reproductive axis. Men and women can experience reduced testosterone or irregular cycles respectively.
Are these effects reversible if someone stops night shifts?
Some changes are reversible. Over weeks to months, melatonin and cortisol rhythms can re-entrain when exposure to light and sleep schedules normalize. However, prolonged exposure may produce more persistent changes like increased adiposity or altered gene expression that take longer to reverse.
You mentioned gene expression. Can you be more specific?
Clock genes such as PER and BMAL1 show altered expression in peripheral tissues after circadian disruption that affects metabolic pathways for glucose and lipid handling. For example, shifted expression in the liver can dysregulate gluconeogenesis and increase fasting glucose.
Are there interventions that reduce endocrine harm for people who must work nights?
Yes. Several practical strategies help. One is timed bright light exposure during the night shift to shift the phase of the SCN. Another is avoiding bright light in the morning. Commute to promote daytime sleep. Melatonin supplementation at the appropriate circadian time can aid sleep quality.
When you say appropriate time for melatonin, what do you mean?
Melatonin is a phase-shifting agent. If taken in the early biological evening, it advances rhythms. If taken in the morning, it delays them. If melatonin is taken at the wrong time, it can shift rhythms in the wrong direction. So timing must be matched to the desired phase change.
That seems complicated for workers on rotating schedules. What about meal timing?
Restricting food intake to the biological day or aligned hours helps entrain peripheral clocks. There are studies showing time-restricted feeding reduces glucose excursions in shift workers and improves metabolic markers even without weight loss.
Are there occupational strategies for schedules that reduce harm?
Rotating shifts that change quickly in a forward direction east to west style are less disruptive than long-term rotating shifts because the circadian system adapts more readily to forward shifts. Also, limiting consecutive night shifts and providing strategic nap opportunities during long shifts lowers fatigue and metabolic strain.
Do you have a real-world case that I could cite in my paper?
Yes, I can point you to a study of hospital nurses. The study tracked night shift duration and found a dose-response relation between years of night work and risk of metabolic syndrome. It also measured cortisol profiles and inflammatory markers, showing more flattened cortisol rhythms and higher CRP in long-term night workers.
That will be helpful. Thank you. One last question. Are technological light filters useful?
Blue light blocking glasses for the commute home and warm lighting in break areas can reduce melatonin suppression. They are useful adjuncts, but timing and combined behavioral strategies are most effective.
This gives me a clear outline for my paper. I will include mechanisms, health outcomes, interventions, and a case study. Thank you for the suggestions.
You are welcome, Maria. If you want, I can review your draft and check the references on clock gene studies and the nurse cohort. Work on integrating specific endocrine changes with the interventions, and we will meet again next week.
I would appreciate that. I will email you my draft by Tuesday and include the studies you mentioned. Thanks again.
Listen again to part of the conversation, then answer the question.
If melatonin is taken at the wrong time, it can shift rhythms in the wrong direction, so timing must be matched to the desired phase change.
This concludes the conversation portion. For more TOEFL practice tests and study materials, visit Spinta.org.